New Africa Broadcasting Network. More than 200 million pregnant women around the world are potentially at risk of infection with the novel coronavirus COVID-19. Do newborn babies need to be separated from mothers infected with the new coronavirus? A growing number of families and doctors are facing this difficult question. Some health authorities, including in China and the United States, recommend isolation of newborns from their infected mothers. Others, including the World Health Organization, WHO, strongly recommend breastfeeding and keeping mothers and babies together, while taking precautions such as the mother wearing a mask. According to the Center for Disease Control, CDC, pregnant people seem to have the same risk as adults who are not pregnant. However, pregnant people have changes in their bodies that may increase their risk of some infections. Pregnant people have had a higher risk of severe illness when infected with viruses from the same family as COVID-19 and other viral respiratory infections such as influenza. Dr. Baker, who is a board-certified in family medicine, emergency medicine, and geriatrics, shed more light on coronavirus and how it may affect pregnant women, breastfeeding, and the newborn, and what they need to do during the coronavirus COVID-19 pandemic period.
Hi, my name is Dr. Terrence Baker. I'm a family practice physician from Baltimore, Maryland. Today we're going to talk about a topic that affects many of you, including pregnancy and coronavirus. And so we want to take a look at how coronavirus pandemic is affecting each of you that are watching this show today. The coronavirus pandemic is still raging around the world. Many pregnant mothers are uncertain of their future. Many questions exist. And so the purpose of this discussion today is to talk about what we know and the recommendations that we have for you. First, you may notice that your prenatal appointments are changed, and some of those appointments may become virtual. That is, your physician may set up a way to visit with you virtually and not in person. Next, delivery wards, labor and deliveries are currently open. However, you may notice that there's a change in the way that they are staffed, and you may notice that there is a very serious effort being made to separate mothers that may be infected with coronavirus from those that are not. Next, home delivery is an option for many mothers. However, if you're not planning to do a home delivery now, it generally is not recommended to try to make a change. Here's the reason why. If you're going to require a recurrent C-section, then you're not eligible for home delivery. If you've had complications or problems in the past with your deliveries, or if you deliver quickly and the time necessary to get the staff to your home may not be available in these days of coronavirus, where staffs are being cut short and the time to get to your home may exceed the time necessary to get there and provide you with a safe delivery. So in other words, if you're not planning home delivery, would not recommend that you make a change. If you are planning a home delivery, I would continue to work with your nurse midwives to continue to work on making that a safe delivery. Next is also remind you that home deliveries do have some complications. 30 to 50% of home deliveries do require the mother and or infant to go to the hospital for evaluation and treatment, either in the emergency room or in L&D, and therefore would recommend, again, if you're not planning a home delivery, I would not do that. The uncertainties of coronavirus are changing everything about your pregnancy, except the fact that there's certain things that your doctor needs you to do as is routine. You need to stay in touch with your obstetrician or family doctor throughout the pregnancy. You need to have regularly scheduled appointments, whether they're by TV or in person. You need to continue to raise questions to your obstetrician about any side effects or complications that you may have during the pregnancy, such as urinary tract infection symptoms, breaking of your water, abnormal bleeding, abnormal swelling, elevations in your blood pressure, all the usual signs and symptoms that can be indication of a problem with the pregnancy need to be reported to your doctor on a timely basis, just like you would if there was no coronavirus. Next, you may notice that labor and deliveries are changing the way that they staff, and the number of people allowed in the delivery may change. Family members, grandparents, husbands may be asked to attend virtually and not in person. Next is there's no evidence that a pregnant patient is more susceptible to developing coronavirus infection. And in fact, the literature to date would suggest that pregnant women are less likely to become infected than not. Next is your baby safety. When the baby's in the womb is the safest place for the baby to be during the pregnancy. Keeping the baby in the womb for the entire length of the pregnancy is the best and safest place for the infant to be. Next, let's talk a little bit about breastfeeding. Breastfeeding is still permitted, even if the mother develops coronavirus. The mother can do one of two things. The mother can wear a mask, an N95 mask, and safely breastfeed the baby. Understanding the frequent hand washing and cleansing, showering of the mother will be necessary before and after each feeding. Also, the mother can pump her breast milk and can have someone who's not infected with the coronavirus bottle feed the infant the mother's breast milk. These are both appropriate and necessary. Next is visitations by grandparents and loved ones, aunts, uncles, friends, neighbors, brothers, sisters need to be minimized. In these days when we must social distance and we must have some self-isolation, it is important to isolate you, the mother, and the infant from others. However, that doesn't mean you can't make telephone calls. It doesn't mean you can't use Skype and other means of social media to communicate. It just means that in-person communication and having grandparents, aunts, uncles, sisters come by and hold the baby and play with the baby and have intimate contact with the baby should not occur. This is a time when keeping the baby safe is important, and the baby must social isolate just like you. The baby must keep 6 to 10 feet away from others when in a community setting. And the only one that primarily who should be holding this baby and caring for the baby is the mother. Okay. Next, even husbands who work outside the home should restrict their holding and intimate contact with the infant, because husbands being out in the community, out in the workplace, are particularly susceptible, particularly in areas like New York and New Orleans, particularly susceptible to carrying the coronavirus, and must be especially careful not to bring it home and give it to the mother, their wife, or the infant. Next is that you'll notice that most states have suspended their face-to-face visitation where safety officers and labor and delivery staff are coming to the home to check on the pregnancy. You'll see that most of those face-to-face meetings through the maternal, infant, and early childhood visitations will not occur, although it will be by telephone or by virtual visits. What are things that mothers can do while they're pregnant and postpartum to stay safe? Well, number one, wash your hands frequently with soap and water. Next, after being out in the community for any reason at all, either for a doctor's appointment or grocery shopping or for any other reason, return home, take off your clothes, put them in the wash machine, and wash them immediately, and go to the shower and take a head-to-toe shower with soap and water. Next, apply new clothing and continue your home activities. Beware that any groceries that you're bringing into the home may be contaminated and need to be cleaned with soap and water or other disinfectant. All packaged containers like soups and jugs of milk and iced tea and all those type of packaged goods need to be cleaned. Social distancing when you're out in the community and even when you're in your own home, 6 to 10 feet is appropriate at all times. If you come into contact with somebody that's sick, you should leave the area immediately, and certainly at the minimum distance yourself 6 to 10 feet from that person. But leaving the person's environment is the best action you can take. Wash your hands, yourself, and your clothes daily. The best way to prevent spread of the coronavirus is to eliminate it by destroying it or inactivating it by cleaning and washing. Also, know that virtually any laundry powder will inactivate the virus in the washing machine, and also the heat of the dryer. Most dryers will inactivate the virus in the dryer. Also, hanging your clothes out on the clothesline can also be good because sunlight and fresh air also contribute to inactivating this virus. If you become sick, immediately isolate yourself. If home, isolate yourself from your family in a room where you can stay away from your family and other family members, and self-quarantine yourself until the diagnosis can be made that you have the coronavirus or another form of respiratory infection like influenza or rhinovirus. Finally, follow all recommendations of state, public, and health officials. These officials are committed to your safety. They will provide you with directions as to how best to survive this pandemic. Direct questions to your primary care doctor or obstetrician are always appropriate to guide you in your decision-making towards maintaining health and avoiding illness. I take this opportunity to remind you to watch out for NABN TV Health Talk Show, Doctors in the House. This is a promotion of good health and general welfare issues in our community. Doctors in the House will be featuring a series of interviews with world-renowned doctors from around the world. You'll be interviewed and to discuss topics of medical conditions that are common and which they plan to supply useful information to you in the coming weeks. So I look forward to starting the Doctors in the House program designed specifically to educate you as to other medical conditions and illnesses that you need to be aware of. Subscribe to NABN TV on YouTube, or you can follow us on Facebook, Instagram, and Twitter. Very exciting. Be the first to know. We look forward to having you join our family of viewers. Thank you.
NABN, New Africa Broadcasting Network.